Hi, I'm Dr. John Harper, and we're here today with Lenore Pinder, and she's graciously offered to be on video and answer a few of my questions so other people can know that we can help them. Lenore, when I first met you, you had some really pretty terrible sciatica going from your back all the way down to your foot, and you would get the pain in your foot as well.
Yes.
So tell me a little bit about that and what you did to try and get rid of that sciatica before you came to me.
I went to San Diego Spine and Rehab, and they tried to do it, but it didn't even touch the pain. It never went away. But here, it did.
Good, good. And you had some shots too, right?
Yes.
Yeah. So when you had those shots, you had a series of 3 different shots. Is that correct? The physician did that, and how did that help you?
Not
Not at all. Didn't do you any good. Okay.
No.
So when you came here and I told you what the underlying cause of that the sciatic neuropathy was, and the way I explained it, did that make sense to you? What I kind of laid out the plan for you? Did that make sense?
Yes. Yes, it did.
Perfect.
You explained everything.
Good. Yeah.
And in language that we can understand.
Perfect, good. And yeah, I don't talk to doctors all day, I talk to patients all day, so I speak in patient speak.
Yes.
So once we got started, you mentioned that you felt relief pretty soon. It started getting better pretty quick, is that correct?
Yes, yes.
Yeah.
Just at the beginning of the week, after an intense working on it, I got up in the morning, I had no pain.
Yes, fantastic.
And I jumped in the shower, came down here and hugged everybody because it was so unfamiliar not having any pain.
Because you had problems for about a good 5 years or so, right?
Yeah, it
right.
was going and going and going.
Oh my gosh, and yeah, I remember that day, and so now you mentioned that that the way that we do things and the way we explain them is that, and so
Yes.
I know we did that in the beginning, and did we continue to treat you that way and explain things and be clear about everything?
Absolutely, 100%.
Good, thank you.
200 if it was me.
Yeah. You had a few questions that we always had answers.
Yeah.
And then so it's my understanding that you've referred other people to us. I know your daughter came and you've told lots of people, and
Yeah.
and you know, now you'd been recommended to have surgery, right? After those shots didn't work, that physician said, well, the only thing I can offer is putting bolts and clamps and rods in your back.
Yeah.
And when you told him no, what would he say about that?
He said, well, I can't do anything for you, goodbye.
And that was that. And now that you're doing so well, you're out walking how many miles a day now?
2.4 miles.
That's fantastic, and not too many 71-year-olds are out doing
No.
that these days. And
And I carry my weights too.
yeah, oh, that's right. I remember. That's great. And so you before, when you were feeling bad, you didn't like life too much. Things were pretty miserable for you. Now that you're feeling so great, how's life?
It's great again.
Yep.
Yeah.
Get to be with your grandson and
Yeah.
active and have a
Yeah.
good time. And you just mentioned that you wish you had some cards in your pocket this morning because a gentleman, you talked to him at the mailbox. Tell me about that.
Yes, I live in Rancho San Luis Rey, and we got a mail room where we get our mail. And when I came out, this elderly man was standing right in front of me, I guess. And he was holding himself and he was groaning, and I said, can I help you? And he said, no, and they haven't done anything about it. Apparently he had a rod put in his body for his back, and the clamps let go, and they're moving around to his inside. Can you imagine the pain that poor guy was in?
My hands are sweating just thinking about
Yeah.
it. That's what a shame he has to suffer. So,
Yeah.
and hopefully he'll get some
I'll
help
run
soon.
into him again. I'm
Good.
going to keep Dr. Harper's cards on me
Great.
instead of at home when
When you walk around. Huh?
yeah.
Great.
Yeah.
Well, Lenore, one last question is that one of the reasons why we like to do these videos is because when patients are checking us out and they, you know, they've been to everybody on the planet and they just can't
Right.
think anybody's going to help them, you know, they get skeptical, and I don't blame them. You know, they've been lied to about other things, and I get that. But you know, as far as our honesty about being straightforward about what we can do for you and how we can help, and the fees involved and the time and the way we treat you, you know, if somebody was skeptical about any of that, what would you tell them?
Don't even worry about it. You will be well looked after. They respect you. They're very, very knowledgeable. That's the big thing. And his assistants are just as good. Oops, so sorry, almost as good as him.
That's all right. Well, I think they're fantastic. Otherwise, I wouldn't have them here
That's right.
because you good patients
They are
deserve the best.
excellent.
Fantastic, great.
Yeah.
Well, hey, Lenore, I want to thank you so much. You're such a nice person, and I appreciate you so. And you're a bit of sunshine every time you come in here. So I just want to let you know, thanks, and I hope you have a wonderful day.
Thank you. Thank you. Pleased to do it.